Hello and welcome. My name is Corinna Cash, and I am a Data and Research Director here at Kentucky Youth Advocates. We are so excited to have all of you with us here today to celebrate the launch of our 34th annual Kentucky Kids Count book. Woo! Over the last 34 years, the Kentucky Kids Count project has strived to make high-quality, county-level data both accessible and easy to use so that communities, decision makers, and advocates have the data that they need to make decisions that are best for kids, best for families, and ultimately best for Kentucky. In today's presentation, we will walk you through this year's book, which is focused on the power of positive childhood experiences as a tool to mitigate adversity. We will then hear from a young adult about the power of kinship care and stable housing on creating those positive childhood experiences, dive into the data from this year's book, and also give a crash course on how to use our very new, very exciting county data dashboard. We can go to the next slide. Because before we hop in, there are two really quick things I want to cover. First, I would be remiss if I did not take the opportunity to thank our sponsors. The support of WKU Life Skills Center for Child Welfare Education and Research, Mountain Comprehensive Care, the Kentucky United Methodist Children's Home, COSAIR for Kids, and of course, our signature sponsor, Aetna Better Health of Kentucky, means so much to us in this work. This project absolutely would not be possible without their support. So a huge thank you is owed to them. We can go to the next slide. Second, I want to give a little background on what the Kids Count project is, how it came to be. Kids Count is a nationwide initiative of the Annie E. Casey Foundation that seeks to track child well-being across the United States so that local, state, and national level discussions of children have the data needed to identify problems and assess solutions. You can learn more about the National Kids Count Initiative on the Annie E. Casey Foundation's website by visiting aecf.org. Annie E. Casey also hosts the Kids Count Data Center, where you can find almost 100 data points related to Kentucky kids and families that we track and update regularly. This data center is also really cool because it allows you to compare Kentucky data to national trends as well as other states such as Indiana, Ohio, Tennessee. And with those two out of the way, let's get started. This world moves really fast, and it's not often the chance that we get to reflect on past work. But this reflecting is exactly what we wanted to do with this year's book. The 2014 Kids Count essay focused on an emerging public health issue that was disproportionately impacting Kentucky's children, adverse childhood experiences, also known as ACEs. At the time, 1 in 5 Kentucky kids experienced more than 2 ACEs in comparison to 1 in 8 nationwide. Looking at today's data, we see that approximately 1 in 4 Kentucky children have experienced 2 ACEs. To address this crisis of adversity, we made 9 recommendations in the 2014 book to address ACEs. In the last decade, we've seen some progress on these recommendations, such as the School Safety and Resiliency Act of 2019, which required schools to have trauma-informed plans in place, which met our recommendations of ensuring work systems that work with kids can recognize and respond to trauma appropriately. With other recommendations, though, we haven't seen the same progress. For example, in that 2014 book, we recommended for Kentucky to enact a refundable state earned income tax credit, and we have not seen any progress on having an earned income tax credit. In addition to looking back on recommendations we made in 2014, we also wanted to talk about what new research has shown us in the last decade, especially how powerful positive childhood experiences, also known as PACEs, can be in mitigating the effects and impact of adversity. Positive childhood experiences are experiences that stem from safe, stable, nurturing relationships and environments, and research shows us that they can protect and prevent children from experiencing traumatic events, toxic stress, and ACEs. This focus on creating positive childhood experiences is really the antithesis of this year's release. And throughout the essay and divider pages of the book this year, you will see that we explore different ways that we can create positive experiences, as well as make recommendations to increase the likelihood that all Kentucky youth will have access to these positive experiences. This includes increasing access to safe and affordable housing so that kids have a safe place to grow and learn and be themselves, increasing access to mentorship programs so youth can connect with safe adults in their lives that they can turn to when times are hard, increasing healthcare access so that youth are healthy enough to participate in their schools and communities, and finally, kinship care so that families can stay together during difficult times. To help illustrate how powerful things like healthcare access or housing or kinship care can be to helping youth create positive experiences and overcome adversity, we feature the story and experiences of several youth in the book. One of those youth has joined us today on this webinar, and I am very excited to introduce Talia. Talia is a 25-year-old mom from McCracken County who's going to share her story on the power of kinship care and safe housing. With that, Talia, floor is yours.
Hello, I'm Talia Hamilton. I'm 25. I'm from Paducah, Kentucky. Being taken in at 8 years old, it was a difficult situation. It was quite traumatic. Me and my brothers and sisters didn't get to stay together, but being with the relatives that took me in from 8 to 18 really made a positive impact on my life. I was able to see her work. She got us all the medical care that we needed, far as dental, eyes, all that. I don't think that I would have had that. I don't think that I would have had that in the environment that I was in. The environment that I was taken from was filled with drug and just toxic relationships. And I'm just grateful that she took me in and nurtured me and loved me and created a space that I could thrive from. I do have two boys now, and we live in Housing Authority Paducah. Um, and I bragged on them in the feature that I had in the book because they've been amazing to me and my boys. They've had like programs and councils, resident based, that have helped us um, navigate adversity. They've given us plenty of resources to get out of poverty and make those lifelong changes that we need to make. They help us figure out the predators in our neighborhood. So, as far as like gas stations and liquor stores and fast food places, we know that those are predators, and we can choose to stay away and navigate our way through the environment that we live in and not stay stuck. I think the motto for Housing Authority Paducah is move up, move ahead. So that is kind of the goal for them. In the resident councils, we're allowed to have a say in how the funding is spent. So we could get community groups together, and make it just a really community based, loving environment for everybody to feel comfortable and feel like they have a voice. They've really helped me find my voice and speak out and just get more involved in the community.
So, Talia, I don't want to cut you off, so just making sure. Perfect. Okay. Thank you so
Yes.
much, Talia.
Thank y'all. Thank you.
Thank you so much, Talia, for sharing your story with us today. Youth voice is so important and so powerful for illustrating the needs to create more opportunities for positive childhood experiences. I believe Mara just put it in the chat, but you can see Talia's feature talking about the power of kinship care on her childhood, as well as the power of stable housing, now that she has her own children in the book, as well as features and stories from other young people. For this next part of the webinar, I am going to take some time to dive into this year's data. Kids Count tracks child well-being across 4 different domains: economic security, education, health, and family and community, and we're going to be walking through each of those. The economic security domain includes our indicators around children living in a household with a high rental cost burden, children living in food insecure households, children in low-income households, and children in poverty. As always, you can view these indicators and more on our data center at kyyouth.org. In order to afford housing, food, childcare, and other necessities, most Kentucky families need to make an income of at least 200% of the federal poverty line. In our most recent data, 44% of Kentucky kids live below this line, meaning they often struggle or may often struggle to afford basic needs. Living below this line puts families at increased risk of things like food and housing insecurity, with 20.7% of Kentucky kids living in a food insecure household and 44% of Kentucky kids living in a household with a high rental cost burden. We saw a spike in children experiencing food insecurity this year, with over 1 in 5 kids living in a food insecure household in 2022 and 118 out of Kentucky's 120 counties experiencing worse rates of food insecurity when compared to 2020. We know that one major factor contributing to the 44% of Kentucky renters experiencing a high rental cost burden, which means that they spend more than 30% of their income on housing, is the shortage of affordable housing in Kentucky. Kentucky is short over 200,000 units of housing, and there is not a single county in the state that has an adequate supply of housing for sale or for rent. Access to safe, stable housing provides youth with a safe place to learn, grow, be themselves, and ultimately create positive experiences. We can see that in this chart that U.S. high schoolers in stable housing are less likely to misuse prescription opioids, experience physical dating violence, or attempt suicide than their peers in unstable housing. To ensure all youth have access to this safe place to live, we recommend making investments in the state affordable and rural housing trust funds, as well as increasing support for programs that help homeowners remove environmental toxins from their homes, such as lead paint remediation. Moving on to the education domain, we cover data around kindergartners ready to learn, 4th grade students proficient in reading, 8th grade students proficient in math, and high school students graduating on time. As with the economic security indicator, you can view county and school district level data for all 4 of these indicators at kyouth.org. So we are excited to say that, as you can see, 3 of our 4 education indicators improved during the 2023 to 2024 school year, a promising sign after the hit education took from the pandemic. Last school year, 50% of 4th grade students were proficient in reading, 37% of 8th graders were proficient in math, and approximately 92% of high school students graduated on time. However, one of our indicators did get worse, and that is the kindergartners ready to learn indicator. Only 48% of kindergartners entered school ready to learn last year, when compared to the 2018-2019 school year, was lower. We know that there are a lot of factors contributing to this decrease, one of which is the cost and limited supply of childcare. The first 5 years of life are a crucial point of development, and we know that childcare in Kentucky can be both unaffordable and inaccessible to families, which also means that children are locked out of the social, emotional, and educational resources that childcare can provide. This year's education divider page, perfect, highlights a crucial non-academic support that helps youth create positive experiences, and that's mentorship. One of the positive childhood experiences shown to us by research to mitigate the impact of adversity is having at least 2 non-parent adults in your life who genuinely care. These adults are people that youth can turn to for guidance and support during hard times, and also just help youth sort through what they want to do with their life, where they want to go. One source of these adults is mentorship programs. Today's young people, Generation Z, are more likely to have mentors than Gen X and baby boomers. This is a really positive sign because when compared to youth without mentors, youth with at least one life challenge and a mentor are more likely to plan to enroll in college, hold a leadership position, and volunteer in their community. It is vital that state and local leaders and community members increase access to mentorship programs for youth and young adults by encouraging schools, community-based organizations, and faith-based institutions to integrate mentorship into their youth programming and curriculum. Next slide. Our health domain covers data related to smoking during pregnancy, low birth weight babies, children under 19 without health insurance, and teen births. This year, we saw lower rates of teen births and smoking during pregnancies, with 119 of 120 Kentucky counties seeing improved rates of smoking during pregnancy when compared to 2015 to 2017. However, we did see a slight increase in both the low birth weight babies and children under 19 without health insurance. Both of these were small increases, but these are indicators that we will be tracking closely over the next couple of years to ensure they don't increase further. We are particularly concerned by the drop in children under 19 with health insurance because we know how vital access to healthcare is to creating positive childhood experiences. This year's Health Divider page focuses on the ways that access to healthcare helps kids create positive experiences. In order to participate in community traditions, feel accepted in high school, or have people in your life that care about you and you can rely on that you're not related to, you have to be healthy enough to go to school and to be a part of your community. In 2022, 5.8% of all U.S. children were chronically absent for health reasons, meaning that they missed 15 or more days of school. As you can see on the slide, there are massive disparities in this number of who is chronically absent for health reasons, with children living below 200% of the federal poverty line and children with disabilities disproportionately missing out on school because they are not healthy enough to go. This is made worse by the shortage of healthcare providers in Kentucky, with 75% of kids living in counties that do not have enough primary care providers and 94% living in counties that do not have adequate mental health providers. To ensure kids are healthy enough to create positive experiences, we recommend improving access to healthcare by creating incentives for healthcare providers to work in underserved community, accept patients with Medicaid, and for health services to co-locate in places where kids already are. Finally, our family and community domain covers births to mothers without a high school degree, children in foster care, children exiting foster care to reunification, and youth incarcerated in the juvenile justice system. We saw improvements in 3 of these 4 indicators this year, including seeing lower rates of births to mothers without a high school degree, lower rates of children in foster care, and lower rates of youth incarcerated in the juvenile justice system. This is something to celebrate because we know how damaging systems like juvenile justice involvement or foster care involvement can be to youth in the long term. However, we did see a decrease in the number of children exiting foster care to reunification, with less than a third of Kentucky children exiting foster care to reunification. We know how important it is to have, or for youth to have, safe, caring adults in their lives who can help them navigate hard times, connect to their community, and provide guidance on life. This year's Divider page talks about one way we can help keep youth connected to caring adults in their communities, even when it is no longer safe for them to stay at home with their parents. Kinship care allows youth to stay with a family member or close family friend, ensuring that youth stay connected with familiar faces in their families and communities, can stay around people they know and around traditions they're familiar with. Between 2021 and 2023, the U.S. Census Bureau estimated that 55,000 Kentucky kids lived in kinship care, but we know that number is likely an undercount because 70% of kinship care arrangements are informal, meaning they are done without involvement from the state, which can make it really difficult to estimate the actual number of children in kinship care. Family and friends often want to help care for a child in times of needs, but there are limited financial resources available to kinship caregivers, especially those who are informal kinship caregivers. For those kinship caregivers with DCBS involvement, there are more resources available, but utilization for some of the resources is relatively low. For example, only approximately 53% of kinship caregivers with DCBS involvement receive SNAP. Approximately 42% receive KTAP cash assistance. Approximately 52% receive Medicaid. And approximately 24% receive child care assistance. In order to keep kids connected and safe, we recommend prioritizing relative and fictive kin placements and increasing support for relative caregivers, such as increased access to financial assistance, respite support, community-based connections, and mentorship. And with that, that is the statewide data trends in this year's book, but you can view county and school district level data and more on our new data dashboard, which we are about to pull up, and my colleague, Lauren Bowling, will be walking us through how to utilize that dashboard. Lauren put a lot of really amazing and hard work into making this not only high quality data, but also beautiful and functional. So with that, Lauren.
Thank you. How's my audio? All good? Okay. Thank you guys so much for being here. We all really appreciate it. This is sort of a new venture for us, and like Corinna said, we're all really excited to show it off. I will say that she gave me a lot of credit, but the whole team pitched in, especially both Sasa and Corinna. So without further ado, this is our new dashboard. It is fully interactive. You can sort by county, and you'll be able to see all of the things that you previously saw in the book form, but hopefully it's a little bit easier to digest. The book is a valuable resource to be sure, but this will allow different people to see data in different ways, which we're learning is super important for understanding and making decisions. So to go over this initial slide here, we'll talk about how to get through the program, or to get through the slideshow, basically. Down at the bottom, you'll see this little clicker area down here. It tells you what page you're on, and you can go both forward and back. When you go up towards the drop-down menus for both the county and the domains, you can either click through those, or you can just click on it and it will pull down a menu and you can choose whatever county you would like to go to. I will say sometimes it's much easier to do that than sit there and just click on it, just from personal experience. This presentation is also completely downloadable and shareable. Up in the upper right corner, there is a small little orange circle with 3 dots. You can download all of the slides, share them, and if you're like me and you have a hard time seeing things sometimes, you can blow that the presentation up to a full screen size. That is super helpful. We also have call out icons here, which you'll see in each of the dashboard slides that will tell you more about our data, where we got it from, any notes that may be helpful to interpreting it, and also the number of children that we estimate are statewide, that are affected statewide. We don't have that information for counties, unfortunately. And then the 2 maps that we have, which are particularly interesting, are our heat map for the latest data for each county, and then the change since the baseline. Now, the latest data basically lets you know how much of a certain indicator is present in a county based on how deep the color is. It doesn't necessarily mean better or worse, it's just a concentration. The change since the baseline map will give you an idea of whether your county is better or worse compared to the initial data that we set out in this year's book. So if you'd like to go to the next slide, we'll go to our snapshot tables. This is essentially a look at all of the domains and all of the indicators in one fell swoop. For those of you that like numbers, this is going to be your slide. So up at the upper left-hand corner where it says Kentucky, you'll notice that that's where we have the drop-down menu and the click-through buttons. If you want to go ahead and pull it down and maybe let's go to Bracken County, see what happens. There we go. So all of the data will change, and you'll have all of the school districts in that county, and then all of the other indicators will show up as well and give you an indication of whether it was better, worse, or it stayed about the same. Now, if you would like to go up on the education header there and look at the data sources, if you want to hover over the 8th grade students proficient in math, you'll notice that there's a little bit of a 0 with a plus sign next to it in Augusta Independent. And that at that point means the data was suppressed by the source, so we don't have access to it. And so at that point, we can't really calculate a change since baseline. So let's see here. Where are we going next? If anybody has any questions about this slide, let me know. Otherwise, we'll continue to go on to the race and ethnicity slide. Okay, so here we have our statewide data as far as race and ethnicity goes. It's searchable in the top left graph. You can search by county. Go ahead and let's type in and see what Christian County looks like. So it'll pull up and you'll get the breakdown of that county by each indicator that we are able to get a hold of. Now, we don't have control over how these ethnicity and races are tracked, but this is what we have available at this time. The other really cool thing is if you go over to the chart on the right, you can actually hover over any of these areas to see what the number actually is and the percentage. The reason this is helpful is because sometimes the print can be a little bit small to see, and it's also color coded, so hopefully that helps as well. And the callouts are going to be located in roughly the same place in each slide, up by the titles. And this one right here, the one that is being hovered over right now, is our racial breakdown by indicator. Again, we don't have data for every single indicator. We have what's available. And again, also the categories might differ just a little bit based on how each data source tracks these things. And I do believe if you would like to just pull the drop-down menu down, we have quite a few. And so hopefully that is going to be helpful for those of you that are interested in that particular data indicator. Okay, let's see about going over to the state data trends next. So here we have different visualizations for those of you that like pretty pictures, which I do as well. Again, the data sources are going to be up in the upper left-hand corner. And there's a lot of them. We put them all in one just to make things a little bit easier so you don't have to click through multiple ones. So for these charts, on the left-hand side, we have all of our indicators, economic security, health, education, and family and community. And you can click through and pick which one you want to see. Yeah, there we go. Now, all of these are going to be in percentage on this particular slide. We do have some indicators that are measured in rate per 1,000, which is a little bit different. And those are going to show up on the chart in the upper right-hand side. So here you'll see baseline and latest data. And as you click through each one of those, you will get to see a change over time. And then the chart below that also has change over time, but for each other indicator as well. That's in the chart on the left-hand side. So yeah, let's see. And then at this point, let's go ahead and go to the school district level data. It's a couple of slides in, mostly because this one is formatted slightly differently from the remaining indicators because the school districts are individually listed on this one. So if you go over to the left-hand side and pull down that drop-down menu, you'll see we have all of the school districts. Again, this is going to be something where it's going to be probably easier for you if your school district is down at the bottom of the alphabet to do this instead of trying to click through. Let's see if we can pull up Bell County now that I've made you go ahead and scroll down there. Sorry about that. Now, Bell County has two independent school districts, Middlesboro and Pineville. Now, on the chart in the data snapshot, those would be included in that table, but here we just have this one school district. So you get to see all of the different indicators comparatively. You can hover over each of the bars, and it will give you a little call out that this is what we're at and the indicator that you're looking at. And then if you want to highlight either the latest or the baseline data, you can hover over the legend up at the top of the graph there. Excuse me, not used to speaking quite this much. And then we'll go over for a little bit more in-depth look at the heat maps. So these heat maps are linked together by indicator. So right now what we're looking at is kindergartners ready to learn. If you'd like to click through, you can see how these change, and they're all for this one particular, or well, this demonstrates, sorry, all of the counties that we have. So the cool things about these is that, again, the latest data heat map shows the concentration of a particular indicator. So the darker the indicator, the higher the percentage or rate. And in this case, it's going to be a little hard for those with independent school districts to try to like drill down on the map. So it can be kind of easier for you to either go through the chart on the left-hand side of the screen, but we do have a super cool zoom function if you'd like to sort of look at that. Yeah, I know this is really cool. I like it a lot. If you go up to the Northern Kentucky counties, I know we have quite a few of them with independent school districts up there. That will make it a little bit easier for you to see and hover over if you would like to do that. And the reason we like this is because it lets you look at the counties right next to yours so you can see how you're doing, or school districts. And again, you can hover over like you saw and pull up the latest data that is available for that district. For this also, you can also hover over on the bottom part of that graph for the high to low. And if you hover over like the 60 to 70%, it will show you which school districts and counties are in that particular bracket. I think that's really neat. Okay, so if we go down to the change since baseline heat map, that'll show you whether things are better or worse. We do have a couple of districts where the data is not available because they are federal school districts. The not available means that we were unable to calculate because of data suppression. So here, again, you can hover over your county, and at the same time, you'll be able to see the change that is there. So we're hovering over Breathitt County. So for fourth grade students proficient in reading, they had a drop of about 2%. This gives you an idea of how you can make, hopefully the policymakers will know whether we need to pour more resources into this or to help in some other way. Let's see here. We'll make sure I go over everything. Oh, and then I did want to go over the download buttons here. If you go up to the right-hand corner, you'll see the little clicky things again. And if you click on that, you'll be able to download it, share it, or go to full screen. And I will say with the download, it is a little bit tricky because it will download the entire presentation in one of 3 different formats. And you want to make sure that you have it on your county because it will download that particular one. If you just download it just to begin with, it will download the first county that's there, Adair County, and it's unfortunately not interactive. So just make sure you make that little adjustment before you decide to download it, and that'll help out a lot. Okay, let's see if we can go to the health slide and show you what the rate per 1,000 indicator looks like. So for this, the teen births is not measured in percentage because it's a low number. So we aggregate the data over 3 years just to make it less personally identifiable. So what this tells you here is that in the baseline years 2015 to 2017, there were 21.7 teen births per 1,000 teens in Adair County. And luckily we saw a drop from to 2019 to 2021. And so this is a little bit different than the percentages. So I just wanted to definitely emphasize that they are definitely not the same. And then if we want to go to the next slide where we have all of our in-depth data definitions. Oh no, sorry, the next one's family and community. And then the last one is our in-depth data and definitions. If you want to know everything about where we got the data, the calculations, when we looked at it and when it was processed, this is going to be where you want to go. In closing, again, I really appreciate everybody being here. If you have any questions, please feel free to let us know, and I will turn things back over to Karenna.
Thank you so much, Lauren, for walking us through this new dashboard. We here at KOA are so excited that this is live, and I hope that everyone else is just as excited and finds it very useful as they are using this data for different projects. The next thing that we are going to do is open up the floor for questions. Please feel free to drop them in the chat or raise your hand and come off mute. Okay, going once for questions, going twice. Okay, well, if any questions do come up as you are navigating this book or navigating this dashboard, we understand it is a lot of data and a lot of information to take in, but please feel free to reach out to us. Lauren and I's emails are both on our website. If you have any questions, we are very happy to answer, help you walk through them, or give presentations about the data. Oh, I saw some coming in. Can we select cluster counties to see a regional count, Lauren?
Not at this time. Now, the easiest thing to do as far as that is concerned, depending on whether you want the latest data or better or worse, would be to use that zoom function on the map. That's going to give you a better idea, and you will be able to hover over each of the counties that are around you and see that data in real time next to each other. That's the best option we have right now.
Thank you. And in terms of hard copies of the book, if you're interested in hard copies, you can also reach out to myself or Lauren, and we can talk to you about what that ordering process looks like. We will have copies of the book available for order, as we have in past years. Any other questions? If not, like I said, Lauren and I are always available to answer questions about the data, the dashboard, help y'all walk through. If we want to go to the next slide, then I would be remiss if we didn't take this opportunity to give you all some homework. So for our calls to action, we have a couple over these next two slides. The first one is to visit our website, kyouth.org, and access the Kids Count data book and dashboard. On our website, you will be able to see this dashboard that Lauren just went over. You'll be able to see the statewide book. This dashboard also includes, like Lauren said, that all of our county level and school district level data, as well as data by race. Coming soon, next month, we will also have those county profiles that folks are probably really used to seeing. That has all of your county's data in comparison to Kentucky's data next to each other. It'll be printable. And as for call to action, like I said, go to our website and view the child well-being data for your county. Share it with your elected officials, whether that's your local officials, your state officials, or Senator McConnell at the federal level. We really want this data out there so that decision makers, policymakers have the information they need to make the decisions best for kids. And then finally, speak up for all kids during the 2025 General Assembly. That will be starting in January and is a really great opportunity to share this data and make good decisions for kids. And one really exciting opportunity we have during the 2025 General Assembly is Children's Advocacy Week. This is our annual event that we have. It includes our rally at the Kentucky Capitol, which will be on March 5th. As well as throughout March 3rd through 7th, you will find a variety of events from webinars to lunch and learns, celebrating Children's Advocacy Week, talking about our blueprint policy priorities, and also talking more about this Kids Count data. So please join us March 3rd through 7th for Children's Advocacy Week. Our day at the Capitol in Frankfort on March 5th. And for those of us who want to know how to be more involved, how to talk to legislators, kind of what that day at the Capitol looks like, join our prep webinar on Wednesday, February 26th. That will be from 12 to 1 p.m. Eastern, 11 to 12 Central. And with that, Thank you all so much for joining us. We are so excited about this launch of this Kids Count book, and we hope you all are just as excited and are able to use this data within your communities with policymakers. So thank you.